So hopefully you've been participating in the monthly calls, and some of you can now put a face to a name. So why don't we go, let's go.
I'm Lauren Marsh, Sierra County Mental Health Service Act.
Thank you, Sierra County Departmental Fiscal Officer. Michelle McAfee, El Dorado County Mental Health Accountant.
Marissa Bay, El Dorado County Mental Health Budget Analyst. El Dorado County.
Michael Leff from Colusa County.
Aaron Valdez, Glenn County. Lori Pincher, Glenn County.
Noel O'Neill, Trinity.
Shoshana Zad, CIBA Tech.
The broadcast is now starting. All attendees are in listen-only mode.
Kathy Patterson, Altern, Modoc County.
Sherry Melbourne, Modoc County.
Adelaida Baca, Modoc County.
Deborah Call, Modoc County. Paula Lena, Honey Smith, Siskiyou. Rose Bullock, Siskiyou. Michelle Turner, Illinois. Raymond Johnson, Merced. Shirley Martin, Mono.
John Buzzowitz, Yolo.
Suzanne Doyle, Nevada.
Allison LaFleur, Nevada. Judy Eckert, Shasta.
And then I think we want to open it up to the phone folks, Shoshana.
Trying. I think we might have to just go on
Okay.
until I figure out how to do this.
So what we're going to cover today are basically just revised revenue estimates based on what came out in the governor's budget last month. And for those of you who maybe are new or somewhat new to mental health funding, we'll go in a little more detail on some of the funding streams. And then really I want you guys to be asking questions as we go through this so that you're to make sure that you are getting some value out of this discussion. So feel free, to prompt in with questions as we go through. I did get a couple of written questions that I'll address at the very end if they aren't covered in here, as well as open it up for other things beyond just talking about revenue streams. So with that, everybody ready to dive in? All right. So here you can see the lovely pie chart that I like to show. It kind of provides a breakout of community mental health funding. This is 14-15. And again, with the two realignments accounting for about a third of our funding, MHSA about a third, and then FFP. And so I'll go through each one of these as we go through it this afternoon. So going back to starting with 1991 realignment and going back to the very beginning, it refers to realigning of funding and responsibility for three things: services, social services, and public health services from the state to the counties.
Muted.
Not unlike where we were a couple years ago. The state was in a dire budget situation back in 1991, and thought, hey, let's go ahead and institute some increases in taxes, give those to the county, but make the counties responsible for all these services. And so there you can see the three revenue sources that fund the 91 realignment. It was a half-cent increase in the state sales tax. It's what our state vehicle license fees, and part of that was an increase, as well as they changed the way in which they valued vehicles to result in an increased state vehicle license fee. And then also realignment. We then fast forward, so we were doing this for roughly 20 years, and we get into, like I said, kind of a similar situation where revenues weren't sufficient, and so the state was looking to shift some more responsibility to the counties and to lower their obligation of state general fund, in this particular case, on the CalWORKs maintenance of effort. So what they did was they said, we're going to take the monies that go into that 91 realignment for mental health, other than the vehicle license fee collection, and we're going to fund our obligation as a state, our maintenance of effort obligation for the CalWORKs program. And in doing that, we're going to backfill mental health, what mental health receives for the 91, with some sales tax increases on this other funding source called the 2011 realignment. The benefit to us was that in statute, we're guaranteed a set amount for our 1991 realignment in the amount that comes over from the 2011. It's $1.12 billion, and that is guaranteed in statute. But really, it was just a way for the state, through this increase in tax on the 2011 side, to kind of backfill a state general fund obligated program, which was the CalWORKs maintenance of effort. Kind of the bottom line is that no matter which way you look at it, we're tied into sales tax. So this is really driven by what goes on in terms of sales tax revenues at the state. The nice thing about it initially was we're guaranteed this minimum amount. You can see here too, as we go forward, once the amount that goes into the 91 account from vehicle license fees and sales tax that we would have gotten and they're using for this CalWORKs MOE, once that equals this guaranteed minimum amount, we start to get growth. And so we'll start to get growth in the 91 account over and above that guaranteed minimum amount. And I'll get into some of the actual numbers because that actually happened in 13-14. And in addition, we also get 5% of the growth in the 2011 realignment support services account. And again, this was kind of a political deal, probably part of which is related to the taking of MHSA money and some other stuff. But really, so we get a little bonus from this support services account on the 2011 side, which is why back in November you guys got like a ton of different checks, and you're probably trying to figure out what's what. But it's because of all this somewhat convoluted funding approach to your 91 obligations. So from just from a process standpoint, you receive these realignment revenues on a monthly basis based on the funds that are collected by the state until you equal the amount that was the previous year's total. So it's kind of like the previous year amount that you got is your base going into the next year. And what we just found out, like I said, back in December, and I don't know why this didn't happen in January, but in December we get a fixed amount for what they're calling mental health. And that's part of that guaranteed minimum amount, so $1.12 billion. You should get that same amount every month. There's now, because there was growth sufficient in sales tax and VLF, you'll start to see a check for what the state's calling your sales tax, mental health sales tax base and your mental health VLF base. And so these are kind of no different than prior to this whole CalWORKs swap of the increase in your base. But now I believe you're going to continue to get 3 separate warrants on a monthly basis, one for your mental health, one for this mental health sales tax base, and one for the mental health VLF base. And then finally, you get a distribution for the VLF collection. Once the state hits the amount that is the base, they place any additional amounts into the growth accounts. And there's a separate growth account for sales tax and one for vehicle license fees. Yeah.
Quick question. If you wouldn't mind going back, the VLF base, I mean, it's been the same amount for years.
So
it's now this year.
so what happened was, as part of that CalWorks MOE swap, they basically combined the sales tax and vehicle license fees that would have gone to mental health and gave that to social services CalWorks MOE swap. Until that met that $1.12 billion, we were just getting the sales tax from the 2011 account. Now that there was growth, you basically have a new base for VLF, which is just the growth amount. And so the amount that you're, and actually there's even a little nuance to that that I'll get to in a bit, but it's completely different now. So you basically have to throw away your old.
Figure that I had forever.
Yeah, because, but again, there's two different things. There's the VLF collection, which you continue to get the $14 million, but the VLF base and this new sales tax base are basically starting fresh with the growth amounts that you received in 13-14, with the caveat that they screwed up on the sales tax calculation, and so that is the reason that the actual base is a little bit less than what you received in growth. Anyway, to make it more convoluted. Yeah.
That does make sense. Thank you.
Thinking, going back to the growth, it is distributed according to a formula, and it's different for sales tax and VLF. And one thing that makes it very difficult, even if you can project how much growth there's going to be in sales tax, what you don't know is how much social services caseload costs are going to increase. And so that is what the growth first funds. Then after that, it goes into a general growth pot. VLF, it just goes to the 3 different programs. It doesn't go to fund caseload costs. And then growth is distributed the year after it's collected. So unfortunately, it lags, by about 5 months when you're already 5 months into the fiscal year before you know the growth from the prior year. And so here, just to give you some projections from the governor's budget, and this is where you'll see some of the convoluted stuff. Like I said, in general, this growth in base down here, which began in 13-14 for sales tax and VLF, should then be your new base for the next year. But because there was an error in terms of how the state was calculating the sales tax, it impacted the base amount for 14-15. And so this is your base for 14-15. The other thing is all this is published, and I think I've published the links before, but it's all on State Controller's Office website under state and local apportionments, current year apportionments, and you can find the health and welfare realignment, and you dive into that. But if you look at 14-15 under new base, you'll see your share of this new base, that's mental health sales tax and mental health vehicle license fees. And so, so you should continue to receive funding, and that's why I say I was surprised I didn't see an allocation in January for those 2 pots. But you should continue to receive funding on a monthly basis until that base is met. And again, the $1.12 million, until statute is changed, that will continue. That is a guaranteed amount. You can see down here where I talk about the growth in base. This is the projection for the growth in both sales tax and vehicle license fees. They're attributed to 14-15, but again, you actually won't see the actual checks until probably November 2015. And so when I talk about what I would use for a budget, I would not include those in your current year budget. But then it goes and increases the base for the next year. And then you can see here we're projected even more growth in sales tax and about the same in growth in vehicle license fees.
Mike, Sorry, there's a question. How do we find out the percentage that goes to our specific county?
So you're going to want to look at the Controller's Office website, and you can see the distribution amount to each county, and you can figure out your percentage. Like I said, on the 1.12 billion, you're going to get that same amount every month. But your share of sales tax and your share of VLF, and I think they did revert back to the old percentages for VLF, but then, and also the old percentages for sales tax. Actually, I'm not 100% sure on that, because what happened with this 1.12 billion, when they combined it, CBHDA recommended that they use the same percentage, macro percentage, combined percentage, that everybody had received prior to this occurring in 11/12. If they're using that percentage, then technically it's not your old sales tax percentage, but it's the combined percentage. And then, like I said down here, this is this 5% of growth in the support services account, and that is supposed to be distributed based on the same percentages as are used for the CalWorks MOE swap. And then back in November, you received a couple of checks from the calculation error for sales tax. Had no, well, it did. It impacted. They reduced the base out here versus this, but it was basically they just made an error and were catching you up, is my understanding. So, you know, in terms of what to look at to actually develop a budget, so again, what I'm calling mental health, or what the state calls mental health, is funded at that same amount, $90.3 million per month. That's the $1.12 billion on an annual basis. You'll continue to receive the same amount until they change the statute and try to take money back from us, but no, hopefully not. You'll continue to receive that same amount, less any of the managed care offsets or state hospital offsets. And with the managed care offset, if you have fee-for-service Medi-Cal inpatient hospital payments or treatment authorization requests that you've approved, that's the match that you'll see is offset against your amount, as well as if you have anybody in a state hospital. And I know some of you, neither of these two apply, which is great. Some of you might have managed care offsets if you end up with a client in a what's called a fee-for-service Medi-Cal hospital. But again, you should be receiving a TAR or treatment authorization request, so you should theoretically be able to monitor that in terms of how much is being deducted. But those are the two offsets. So you might not see a net dollar amount that's the same every month, but on a gross level, you should see the same amount. Then we have, for the current year, we now have this mental health sales tax base. And again, I would highly recommend going and looking at the State Controller's Office website as to what your base is to get your share of that $11.6 million. I think you can include that in your budget for the current year, or should anticipate that, as well as your share of what they call the mental health VLF base of $11.2 million. It's not huge, but it adds up. And then the VLF collection, you've already been fully funded at the full $14 million. And that was in distribution September through December. Yeah.
On the new basis, the sales tax base and the VLF base, the first distribution was in December, and then they posted the new base.
Yes.
The January payment, I don't see any reference
Correct.
to it on the reconciliation, and the column now says pending. There's zeros all down it, but if you go look on January instead of the date, it says pending.
Pending. So they
Both the VLF and sales tax on the
on the base it says pending, or on the distribution.
On the distribution.
Yeah.
Year-to-date distribution.
I mean, I think obviously this is not super straightforward, and so I'm not totally sure if they might have over-allocated. Yeah.
late yesterday. That's what it said. But I didn't see a reference to it in the recon that there was anything going off to those 2 items.
Right. No, correct. And so I think maybe they overfunded it in December. I don't know. I still think you got to go with what's in the base because that is what's in statute. Now, that's not to say that they can't revise the base, but you know, at this point, I think, I mean, I anticipate those revenues. I think we're going to see that there's definitely going to be enough funds. It's just a question of whether did the state somehow make a mistake in calculating these initially.
I panicked that it meant that the December amount was all we were going to get, even though it's about a ninth of the base.
Yeah, no, I would think you're going to get more. Now, what they might do, I mean, they can play games on the timing, I think. They could potentially say, well, we need to fund all the other programs up to what they got in 13, 14, and then start to fund. So it could be a timing issue, but I think you've got a budget. I think you should anticipate those revenues. And hopefully we'll get a better sense, and because again, so that they had this error in the calculation on the sales tax that they had to deal with. All of a sudden now there's growth in both VLF and sales tax above the 1.12 that they hadn't had to deal with before. And you know, dealing with state controllers very much, what does statute say? You know, what's my authority? And so there might have been some things that got a little messed up or a little bit slow. I think if we don't see anything in February, that it will follow up.
I wonder if your thought about that they're waiting till Cal again to
it's full amount, just in case, right? Because in case, so if there was a decrease in sales tax or VLF, then everybody's reduced proportionally. But you're right, they wouldn't want to give money to the mental health accounts until the CalWORKS MOE is fully met at the 1.12 billion.
Which would imply that this is a true base.
It's not. But you bring up a whole other point. Up until we got the guaranteed amount in statute, we never had a true base because, as we saw in the early 2000s, if sales tax actually goes down, then you're not fully funded at that prior year amount, and everybody loses proportionally. And the downside to that too is then there's not money to fund the social services caseload cost increases, which then start to build up and accumulate over time. So it takes longer and longer to pay those off before you even have growth. So it's a base when funding's good. But if funding goes down or sales tax goes down, which it's not doing in the current year, believe me, and it's not forecast for the next couple of years, but you never know, then you wouldn't receive that base. So,
but the $90.3 million per month is
guaranteed.
It's guaranteed.
It's guaranteed. And
so
I mean, the downside is it potentially, and we'll look at the 2011 account, but by having that guarantee for this, it could adversarially impact the behavioral health sub-account if revenues decline. But hopefully, I mean, things are looking good, so let's not go there. So that's just what I would consider for current year. As well as a couple of other things. So again, none of your, there were obligations under 1991 mental health realignment. One is some of you, not all of you, but most of you have a county maintenance of effort. It's probably not very big with most of you small counties, but it is a requirement for participation in the 91 mental health realignment program. And either you're involved or your auditor controller or somebody is involved in the quarterly reporting, although that's kind of lagged a little bit back to the state controller's office saying that you're complying with this. So that still remains. And in fact, there's a couple of information notices and policy letters that specify the amount. If anybody doesn't know that amount, you can email me or Shoshana and we can provide you guys the revised schedule that was revised in 96, 97, I believe. So not something recent. And then again, in 13-14, or excuse me, in 14-15, you received cash associated with the 13-14 year. And so it was this, I think all of this came in November. You received a share of the growth in mental health sales tax at $15.7 million. Mental health VLF was $16 million. There was the 5% of the support services growth account of $9.1 million. And because of this error in the sales tax calculation, you received two other checks associated with mental health sales tax and the 5% of support services growth. So back in November, you received a bunch of different checks. Again, I would definitely look at the State Controller's Office website to make sure that those got posted correctly within your county. I know you guys brought it up early on, the data in terms of, you know, what were we supposed to do, and you know, so you definitely want to look at the State Controller's Office website and make sure that they were posted appropriately to mental health and didn't end up, you know, funding your sheriff. So that's 91 mental. Oh, that's the current year. So then budget year. Couple of things. Again, the $90.3 million you're guaranteed. So that's not going to change. So I would definitely recommend budgeting that same amount. I would go with the current year base, the 14-15 base, as a starting point for the mental health sales tax, your share of the $11.6 million. And then the same with the VLF. Go with the current year, the 14-15 base, because again, we won't know the growth in either of those two accounts until November of 2015, in all likelihood, maybe October if we're lucky. So to budget the growth at this point is pretty aggressive because, again, even though sales tax is coming in good, everything looks great, it's a little bit risky to count on the growth to fund existing programs. And then with the VLF collection, I just keep budgeting that because that, again, is in statute. It's a guaranteed amount. And it's just a small little smidgen of the amount of actual collections that they receive. So that you're budgeting, basically, how many of you have the opportunity to do mid-year budget adjustments? It actually account for new revenue in the current year? Okay, good. So if you would basically be doing a mid-year budget adjustment current year and then probably just carry that same amount going forward into budget year at this point for the 91 realignment. And then again, like I said, the growth, the 14-15 growth will be known hopefully in November 2015. And then again, you go into, if you needed to, do a mid-year budget adjustment in 15-16 at that time to accept the additional revenues that are in the growth. And it's a double positive in that you get the check, so you'll get your share of the $28 million for 14-15 growth in November, but then it also increases your base for that year. So it's a win-win situation. But again, it's not something you want to budget for, you know, at this point, looking at your 15-16 budget. At least if you're conservative. If you absolutely needed the money, you could roll the dice, but that's obviously not the best way to look at this. That's 91 realignment. Anybody questions or? Again, pretty positive that we're starting to see some growth. We really hadn't seen much growth. We were able to get a little bit built into that 1.12 million or billion, but we really haven't seen much growth, and so it's nice to finally see some growth in that account. Yeah.
This question goes back a few minutes ago. They're wanting to know if the figures are available in MedECC library.
No. So, am I on the internet here? Can I?
Yeah, people.
Can I pull up some websites or?
Oh,
Or am I going to blow this whole thing up and disconnect everything? We'll send out the link to the State Controller's Office website.
Okay.
But it's all, and you really should familiarize yourself with that website, because there's a lot of information that you can use to reconcile warrants that you're receiving, and also to use, again, for budgeting what your base amounts are. But we can send out that link. I think we have in prior small county things, but we can send it out. All right.
We needed to keep tabs on the auditors and controllers to make sure they don't screwball things like they did all this minute.
Right. Right. And and I'll be honest, it's so on the warrants themselves, they try to reference the statute, but often the statute isn't necessarily the statute driving why you're getting that revenue. So, for example, if they're referencing, for example, the 2011 realignment statute for your share of that 1.12 million or billion, but really that's supposed to go into your health and welfare trust account. So the references aren't always great, but you definitely want to track it, and especially too if you have new staff in the auditor controller's office who aren't familiar with some of this, it's good to provide a little bit of education to make sure things are posted where they should be. All right, so 2011 realignment. So again, we had, similar to what we had 20 years prior, budget shortfall at the state level. They can't meet their state general fund obligations, and so they said, we're going to dedicate a certain amount of the sales tax to these realigned services. And those were services, a bunch of this is the public. So you hear the public safety realignment, that's what this is. We had a little bit, mental health had a little bit in here in that our EPSDT services were funded a little bit with state general funds, and we received a managed care allocation from state general fund monies. And also prior to 11-12, where mental health had the obligation for educationally related mental health services, or AB 3632 services, we also sometimes received a little bit of state general fund monies, either in the form of an actual distribution or in the form of an SB 90 state mandate claim for those services. So what this did, well, first of all, we eliminated the AB 3632 educationally related mental health services obligation, but it took this then took our EPSDT and the managed care allocation, as well as all the substance use disorder services that were funded with state general funds, and put them into what is called the behavioral health sub-account. And again, what they did is they took part of the existing sales tax, and so really what they did is they took money away from education as part of the Prop 98 mandates that the majority or roughly half the funding go to schools. And so by reducing the amount of money that goes into the state general fund, they lowered their obligation there and then dedicated it specifically for this purpose. Prop 30 then came along, and they actually basically increased sales tax by 5% to keep the funding for schools. But anyway, it's sales tax. In 11-12, there was they amended through Assembly Bill 100. They amended the Mental Health Services Act to redirect about $860 million or so of MHSA money to fund those obligations, state general fund obligations, in 11-12, and then beginning in 12-13, it was funded out of this new behavioral health sub-account. And so here you can see some of the revenue projections for the behavioral health sub-account at the macro level. Again, the 11-12 amounts for especially mental health managed care and EPSDT, those were actually from funded through what had been at the State Mental Health Services Fund, And then the 1213 amounts, this is what set kind of the initial allocations for the behavioral health sub-account. Those were the specific amounts that they had for each of those programs, EPSDT. And EPSDT consisted of the existing EPSDT program, Healthy Families program, shift from Healthy Families to Medi-Cal, and then the KDA settlement, or the new KDA services, what they estimated there. We then had, and then all the substance use disorder services. There also is a separate amount that goes for the perinatal residential, or actually no, just the residential treatment that's in, I believe it's like 6 or 7 counties. They get $5.1 million special allocation. Doesn't change, doesn't get any growth, but it isn't included here. So there was a little bit of growth in 1213 that then created our base for 1314. We saw a little bit of growth in 1314, which we're waiting to be distributed. That will increase the base to 1415. And then you see this huge jump with some new growth that we anticipate to be earned this year. Part of that comes from, I mean, just the positive growth in sales tax. But the other thing that was part of this realignment legislation was a restoration of $200 million to social services. Once that was met, then all of a sudden behavioral health sub-account starts to get almost, I believe it's almost 50% of the growth that occurs. And so we start to see, and we would anticipate to see the same sort of level of growth dollar-wise going forward, and it's pretty hefty. But in terms of how to budget for this thing, I mean, it's very frustrating, I know, for a lot of you. So for the current year, the state actually published the information notice that specified the percent of the behavioral health sub-account that each county receives. I don't have that off the top of my head, but they did publish that. So you'll continue to get that until the base of a little over $1 billion is met, and I think that will easily happen. What happened in 1415, and hopefully you're aware that your allocation percentage changed from 1314 to 1415, and it was for 2 reasons. One is they took the 1314 and they adjusted it to include a $100,000 minimum drug Medi-Cal allocation, which impacted a lot of you. Even if you weren't doing drug Medi-Cal, in that allocation formula, they've set aside $100,000 for you. They then took the 1213 growth and added it to that adjusted amount for 1314 to come up with, here's how much each county's dollar amount is, which then drove the percentages, which are used to determine your share of the $1 billion. So for those of you who received the $100,000 minimum drug Medi-Cal, you probably saw an increase in your percentage. For those of you that didn't, you probably saw a decrease in your percentage. And we probably, I don't know if all small counties, did you guys were probably already over that 100,000?
Right, yeah.
Yeah.
And we got a huge decrease.
Okay. The plus is that there was some growth, so hopefully overall, even though your percentage went down, you're still going to at least get the same amount of dollars. So that's why the percentage changed from 1314 to 1415. The other thing that we have coming up, which we heard about in financial services, there's $60 million of growth that the state has yet to allocate back to 1314. They continue to say they're going to use, they being DHCS, the same approach as they did for the 1213 growth. So what they will do is they'll look at how much they distributed in 1314 through the behavioral health sub-account that they're going to attribute to the EPSDT and the drug Medi-Cal program, and they're going to compare that to your approved claims submitted through the end of December, and say either you were over or underfunded. And I believe they're adjusting all this based on the whole settlement process that we used to go through for EPSDT and then drug medic, which applies a baseline and all that sort of stuff. And then for the drug Medi-Cal, I'm assuming it's just the 50% match for the 50 percenters. And they'll come up with, based on that, saying, here's some counties that did not receive enough money in 13-14 to fund their approved claims for 13-14, and they'll fund them first with that $60.1 million. And then the rest will be distributed to everybody else based on just your share, your allocation percentages from 14-15. And it sounds like they're trying to get that done by May. The problem with all this, as we heard again today, and I know there are probably more than just one county with potential issues with their claims from 13-14, and how is the state going to deal with that? And we still have the whole issue that they're looking at claims which aren't necessarily your actual costs. Hopefully the plus out of this is that not much gets distributed based on this underfunded thing, and that everybody gets a good share of the growth. I mean, that's kind of what we hope. But, and then, so they're doing this for the 13-14 growth. At some point, I don't know how they're going to say how much of your behavioral health sub-account is EPSDT and how much is supposed to be drug Medi-Cal when they're just giving you this general growth. So, they're doing this to appease some of the folks, stakeholders who have threatened lawsuits. But hopefully as time goes on, we get more overall growth into this account, it will just be spread based on, to everybody, just based on your allocation percentage. And we may even see that happening a little bit this year for 13-14, I think for sure for 14-15, because there's just so much growth that we're going to see in 14-15. So the reality from a budget perspective, I don't think you can budget this at this point. Hopefully you don't have to do it to make your bottom line, because you're probably, at the earliest you're going to get it is the end of April. You probably wouldn't even know the amount until April. And I would be surprised if you don't get paid again until May. So again, it's kind of a convoluted thing, but from the state's perspective, they're trying to avoid lawsuits. And so they're saying, hey, we're fully funding the people who spend the money, but it isn't really true. Yeah, sure.
In context, one of the things that we talked about earlier is with the licensures and the certifications of the drug Medi-Cal sites, they haven't come out and given the okay to bill for specific sites. You can't increase your AOD revenue.
Right.
So it's not going to be reflective of who's doing drug Medi-Cal and who's not, because certifications are over a year behind. In some cases, over 2 years.
Yeah. Well, and it's going to be worse in 14-15 when you get this 100,000 minimum drug Medi-Cal, and if you're not even certified, like you said, if a county is not even doing drug Medi-Cal, you've got to increase your EPSDT by more than that just to show any sort of. But we don't like the approach. Obviously, we think we should be looking at things like utilization, costs, those sorts of things, but not claims. Anyway.
Mike, a question for you about, just kind of following up about like those drug Medi-Cal that's hung up because of certification. I mean, really, truly, are those going to be billable at all because of the timeline? I mean, they'll just be submitted and denied. Right. And because you'd have to have a good cause code somehow. And but
they never get factored into, because of the short, they're doing 6 months after the fiscal year, which, it's not enough time to really look at the true cost of drug Medi-Cal or EPSDT. The alternative, which was kind of floated at one point, was some sort of settlement process where 2 years down the line, they relook at the data and say, well, we should have done this, and so we're going to take growth from 2 years down the line to rectify that. But, I mean, that also starts to get kind of the bottom line is it's supposed to be realigned. and we've got EQROs and all that to test to make sure we're doing our obligations. And so don't try to micromanage it. But they continue to do it. I wouldn't be surprised to see the same thing in 14, 15. But I also believe so last year, like I said, there was $27.8 million in growth, and roughly 27 million of that, or 7 million of that, or 8 million, went to what they call the underfunded counties. Well, now all of a sudden, and then everybody got the other 20 million. So now you go 60 million. Well, if it ends up being about the same dollar amount, then all of a sudden we got 50 million or so going out to everybody. So pretty soon the counties that were underfunded are, because of just the general growth, are no longer underfunded. And so it kind of, I think that's what, I'm hoping that's what the state's kind of waiting for, and then we can get out of having to talk about this. But at this point, that's what they're doing, for better or worse. From a budgeting standpoint, and this is the other problem, and we've tried to communicate this to the stakeholders who threaten, the lawsuits, that a county, if you don't know you're going to get this money, because your share of that 60 million in 13-14 growth is highly dependent on what Los Angeles does. If Los Angeles goes up 5% and takes away, most of the growth, you could have doubled your program, and you're going to get a marginal, return. And then you've also so you've incurred the certified public expenditure in 13-14, and you're also not getting the revenues until you're almost closed out of 14-15. So there's a timing issue, and you got to talk to your CAO, and they've got to be willing to cover that, either with general fund or something else, until you're, quote, made whole. So it's not pretty. I don't think this is what we anticipated, but hopefully, again, because of these large growth amounts, it may just kind of take care of itself. Is I think what we're kind of hoping.
So it's clear we don't budget the growth. I mean, because you can't.
Right.
You can't even begin to forecast it. But Mike County has experienced wild fluctuation in actual dollars, not just our ratio. Our ratio dropped between 12-13 and 13-14 so much that our actual cash went down almost 451,000.
Taking into account the new base, the higher base?
11 realignment, actual cash received in 13-14 was 450,000 less
right.
than actual receipts in 12-13.
Right. So you're right. So cash flow, yes, because the cash flow is going to kind of come in at the same rate, but you should continue to receive more payments beyond. So, for example, because the base went up, so you're getting a lower share of a higher base.
No, we're not. We got fewer dollars.
Cash flow, yes, I agree, because the amount of money that's probably coming in, maybe it's a little bit higher. But remember, last year you didn't get a payment, I don't think, in August, because that entire month went to growth.
Right.
So your last payment will be the flip. It'll be a lot higher because the base is higher. So they won't cut off. So here we had a base in 13-14 of $987.1 million. Once that was hit, no more payment.
Right.
Now they're going to continue to pay your lower percentage, but at least up to the $1,047 million.
But the difference between what we received in cash in 12-13 and what we received in cash in 13-14, even including growth, was
less.
400.
So you're saying 12-13 to 13-14?
Dropped.
Because this 27 wasn't enough to make up that difference in your decrease.
Even if you include the growth that we didn't receive till 13-14 in the 13-14 revenues, we still received 450,000 less. And I'm projecting that this year, if we hit the numbers and at our current ratio, we will go back up a little, but we'll still be about $310,000 less than we received in 12-13. So we're about $750,000 short of where we'd have been if we'd gotten the same
percentage
level cash. No,
so
not the same
what
percentage, but the same cash in 12-13, 13-14, 14-15. We're about $710,000 lower. And the problem with that for budgeting is they want us to send out that account every year. They don't want us to start reserving a balance. So we budget to spend it, and then by the
It all
time we
comes
know
down.
that our ratio's been reduced,
Right.
it's midway through the year, and now I'm getting $450,000 less in a small budget, much of which is in my alcohol and drug program budget, which is microscopic, and we're stuck.
Yeah, and so the problem that happened in 13-14, so we had all this categorical stuff here in 12-13, and they went away from that in 13-14. They just combined it all together and did it purely based on your EPSDT. So, I mean, that's the problem with what they did in 13-14.
And then the sub-TMOE question has never been answered
Right.
by the state, and so we're still thinking we have to spend our whole $652,000 MOE in drug Medi-Cal. So what gets cut is the money we have available for EPSDT,
Right.
which we can't not spend. We're really feeling like we don't know how to budget to this. We don't.
No,
we
and
don't have
it's a
any
problem. I
forecast
agree.
What we'll really get is going like this.
Yeah. But again, hopefully the growth is sufficient that it will cover any potential decreases in percentage. But what you got hit from was the 12-13 to 13-14 because there wasn't enough growth.
And we haven't covered with the growth.
And you are, so your 14-15, you're anticipating more than 13-14.
Yes, but lots less.
Still than less 12-13.
We're still about $310,000 less than 12. Cumulative is still
Yeah.
$700,000, which, you know, to LA would sound like pocket change, but to us it's
Right, right. Yeah, again, it's part of this whole timing thing. I mean, because what do you do? You're looking at, you're setting up your budget for 15-16. What they'll probably do for 15-16, I think I have this under the budget year. They'll do the same thing for looking at the 13-14 growth. So they'll take the 14-15 allocation plus the 13-14 growth. Well, the problem is, right now, you don't know what that growth is. I mean, again, I guess you could have CBHCA survey folks, but that's not going to get it there either. So all you can kind of do is budget what you think you're going to get this year, which right. But again, if LA takes on some initiative and increases, then you're all going to get less. Which is the really frustrating thing. So you're kind of tied into this. You're highly dependent on what the large counties do dictates the amount of funding you're going to get, irrespective of what you do. But that's, again, I think over time that will lessen, but it's a hard reality right now. And you could push CBHDA to push harder on some of this stuff, because this, I mean, the unfortunate thing, the statute itself says that the schedule is developed by the state with input. It doesn't say, with input from CSAC. So yeah, we can provide all the input we want, but if the state wants to do this, they can do this. Here, so. Yeah, and so the other thing too, also with I forgot about in the current year, we also had that error with the sales tax adjustment here. So you received a little bit in 13-14 monies back in November that should have gone to your behavioral health sub-account. But again, in terms of so the amount to budget for next year, and I think unfortunately in your guys' case, less than what you got in 12-13, I wouldn't budget any more than what I anticipate receiving this year. I don't, but then you're right, once that goes up, you're going to have to do either a budget adjustment, but also recognize that the 15-16 allocations probably will change from what you're getting this year, because they'll probably take the 14-15 allocation, plus however the 13-14 growth is distributed. Once the 14-15 growth is known, the dollar amount, you can make a budget adjustment, applying whatever percentages they've set up for 15-16 against the higher base. But I don't think you can do that until you're into November 2015.
I would be grateful to be able to do an increase.
Yeah, no, I understand. But it's part of it's the way the state set this up. Yeah, Sharon.
But just to rephrase, we budget for 13-16, which we're all agreeing our budget for 13-16 right now. You're recommending we budget what we received this year.
What you will receive this year.
The tax collection, that error in tax collection that.
Yeah, don't factor that into anything.
Factor that, but everything that we've received.
I mean, what I would do.
Sure we pull that out from the figure.
Yes, and so what I would do is look at any one of the monthly allocations, or look at the year to date. Figure out what your percentage, what you're getting percentage-wise, and I would multiply it times that $1.047 billion base that we have for the current year, and because that is what you're going to get for that part, and that's what I would budget, and that excludes the actual gross payment that you got for 13-14 in this year, as well as the error in the sales tax. I mean, you could be more aggressive, but I wouldn't recommend it, and take your percentage of the current year allocations and multiply it times the projected base for 15-16. But I mean, you're setting yourself up that if your percentage goes down,
better to under budget.
Yeah, as well as it's not guaranteed those revenues will come in, but I will say that I think the numbers in here were based on about a 6 or 7% increase in sales tax. I think it's coming in at like 10% higher than last year, year to date. So it's looking real strong, but to be conservative, I would just figure out what my share of that $1,047,000,000 is, and I would just carry that forward into next year. And then if you have to, you can do next year, not this time, but maybe late November, once the new base is published for 15-16 and the growth is known, we'll also know what percent you're receiving of the 15-16 allocation. You can do, hopefully, an upward budget adjustment at that point. As well as, well, you wouldn't know what your 14-15 growth is. So. There was one other thing that was interesting when I looked at the realignment. The chart that comes out in the governor's budget, there's a footnote that says EPSDT and drug Medi-Cal programs within the behavioral health sub-account do not yet have a permanent base, which I think relates to all the other programs in the 2011 actually had specified percentages in statute, but I'm not sure if the administration is looking at something even more into that. But what this could mean is that at some point, maybe there will be specified percentages that kind of are the minimum that everybody gets, which would be nice. So, anything else on 2011 realignment? I mean, the other thing that's interesting or funny, or depending on your point of view, is that the state is, it's looking at this at kind of these different programmatic levels, but the statute itself says of this $1 billion, you got to spend it on EPSDT, mental health managed care, and then the substance use disorder services, and doesn't specify a certain amount for each. So you should be able to use it accordingly. And with mental health managed care, the managed care allocation and the statutes associated with that, we're pretty broad in that It isn't just the managed care offset that you see against your 91 realignment, or it isn't just the Program 2 providers or the psychiatrists, psychologists that you contract with, but it is your entire mental health program. So theoretically, you should be able to use this money for anything, but the state continues to look at it on a micro level. Yeah, no.
And just kind of speaking to that, before our county was drug Medi-Cal certified, we were using our non-drug Medi-Cal money to support our substance use treatment program, but there wasn't enough. So we were borrowing money or shifting money from the managed care allocation to essentially underwrite the alcohol and other drugs. So now that we are certified, the $100,000 really comes in handy because it means that we can spend that managed care money, you know, for inpatient costs.
Yeah, yeah, but you also bring actually the whole other point on the SAFTI and the use of SAFTI funds, where a lot of, especially you guys, have used those funds to do drug Medi-Cal services basically without having to bill it, and you have the funding for it, and that you're really not getting credit for that as a part of this. But anyway, yeah.
Another question. For MHSA-funded programs that generate realignment 2011 EPSDT specifically revenue, is it appropriate to not pay back the MHSA fund with that revenue and instead use it for other programs?
So no program is generating 2011 realignment. It's an allocation. Is it appropriate to take 2011 realignment and use it to fund an MHSA program? Sure. I mean, there's nothing wrong with doing that as long as the expenditure is within the context of what is allowed with the 2011 realignment funding. So you really need to understand 2011 realignment, even though it's EPSDT, and there's this quote being made whole thing, it's not on a claim-by-claim basis. It's an allocation, and it's based on whatever revenues are received at the state within the fiscal year. They then are saying that they're going to allocate the growth based on your claims, looking at drug Medi-Cal and children's Medi-Cal combined, the EPSDT combined, but that's just how they're going to allocate growth. It's not that you generate revenue in the same way that you used to get state general funds by providing an EPSDT service and getting a reimbursement from the state. So, but it's totally appropriate. In fact, you know, depending, I totally agree with what you guys are doing in terms of I spend this down first. I mean, this is the one account. I spend this before I spend 91. I probably spend this down before I spend MHSA. Depending on where you are with MHSA, if you are at risk of reversion, that might not be a good idea. But assuming you're not, then yeah, this is the one you're using first. And then kind of MHSA and 91 depends on where you are with fund balances there. But it's totally appropriate that some of these 2011 funds can go into an MHSA program. Yeah. So let's talk about MHSA. So, you know, it's a tax on, yeah.
Just one, when you say spend down the 2011 story, there's really no documentation that shows that we're spending that down.
No, there's not. Yeah, it's more internally.
Right.
You know, so, and really I think where it plays out is when you do the cost report. And whether you want to do it on the cost report or not is kind of arbitrary, but I think it's a good exercise to say, okay, number one, how much did we spend on under 21 Medi-Cal services, and what was the match that was required for that? And then I would look at what were my managed care offsets, what did I pay to contract Program 2 providers, and what was my match for that? And then did I want to potentially cover the match on utilization review, because I have to have that as part of the Medi-Cal managed care plan? And do I want to use part of the 2011 for that? Do I want to cover part of administration? Because technically administration now is supposed to be administration of the mental health plan. And then what else do, so I'd look to spend, and whether you do it again on the cost report or if it's more a budgeting exercise, or I just think I would use those monies before I would necessarily use MHSA or 91, just because I think you want to show that you're spending those. There isn't that much accountability for it. There probably will be at some point.
Because the state does require it to go into a special revenue fund. It has to be kept separate.
Right.
At some point, the state could require us to report what our balance is.
Correct. I mean,
If you've got a
and
balance,
they could be doing
obviously,
this, yes, then you're not doing what you're supposed to do, and
You don't need that money.
right.
It could become a problem, though, if you have any SAPT allocations that are looking at being underspent, say prevention and your prevention guide list or something, and at the end of the year, if you've covered those funds with your realignment and you're doing QFFMRs and then look at your cost report and you underspend, and the next year they reduce your prevention allocation in SAPT.
Yeah, I was talking about purely from a mental health perspective, but that's a good point on the substance use disorder side. So you may want to look at it differently for substance use disorder services than the mental health.
For most things, you're supposed to spend the MRE first.
Yeah, and we're still not sure, like you saw on the SAPT MOE, now you have this $100,000 that a bunch of you who probably couldn't, I shouldn't say a bunch, some of you smaller counties definitely would have trouble spending $100,000 on substance use disorder services in a year. Does that mean that it's going to adversely impact SAPT allocations? And that's why we keep asking the question. I don't know if we're ever going to get an answer, but anyway. MHSA? Revenues are up. Millionaires are doing well. So hopefully it's the tax on the millionaires on income in excess of $1 million. Very few folks pay it, and there's really two sorts of deposits into the State Mental Health Services Fund. And this is in the Act itself. So 1.76% of all monthly personal income tax payments are moved from the State General Fund into the Mental Health Services Fund at the state level every month. Those are payments that anybody who has state income tax deducted from your paycheck, 1.76% of that's going in. Those of you that pay estimated taxes, 1.76% to the state, 1.76% goes into the State Mental Health Services Fund. Those of you that owe money when you file your state income taxes, 1.76% goes into the State Mental Health Services Fund. And that's on a monthly basis. There's then a settling up between the 1.76% that goes in on a monthly basis versus what the fund actually earned in a given fiscal year. And that occurs basically 2 years after the tax year, and then is deposited into the fund on July 1st. And again, so it's really a settling up of what the fund actually earned versus what was done through this 1.76% monthly transfer. So that's what goes in at the macro level, at the state level. Then what you guys see is what is unspent and unreserved at the end of a given month. So what has not been spent, and really it's the unreserved part, because what gets reserved at the state are, the state is allowed to appropriate up to 5% for state administration of this, and they do that right away. So they're reserving 5% of what they anticipate the cash to be for the year. They reserve that in the first month. And then as they spend it down, it gets smaller and smaller as the year goes through. The cash transfers are largest in months in which there are quarterly tax payments in the year-end tax payments. So, and actually, it's the month that lags because they're due by you make the payment in January, for example, is when the estimated tax payment is due. you would see that distributed on February 15th, on or by February 15th. But you'll also notice here that January, April, and June, which then are February, May, and July, because the July distribution is associated to the prior fiscal year. Those are all in the back half of the fiscal year, so it's really, you get most of your revenue in the last 6 months. The annual adjustments, as you'll see when I pull up the numbers in a minute, are incredibly volatile. Like I said, it lags by 2 years because it takes that long to settle up with the actual tax returns. The fortunate thing is that it's known by March 15th for when it gets deposited on July 1st, which then gets distributed August 15th of the next year. So you know it going into a fiscal year. It helps a little bit with the budgeting for MHSA. And so you can see here, these are all the revenue estimates. Everything but this $1.4 billion out here in 16-17 of cash transfers, all this is from the governor's budget and what they're estimating. So you also see this negative $64 million. That was because in the 2009 tax year, the 1.76% transferred too much to the fund, and so the fund actually had to pay back the state general fund $64.5 million out of the $910 million in cash transfers. But you can see, you know, it's as the economy improves, you know, we're slowly catching up. That $479.8 million was deposited in this past July. That's why your August 15th distribution was way off the charts. But that is a known amount, so that's a good thing. The other thing is year to date, looking at personal income tax revenues, I believe they're up pretty significant as well, somewhere around 9–10%. This $249 million is the projection for what will be deposited on this coming July 1st. We'll know in about a month and a half on March 15th what that amount actually is. So we'll find out how accurate they were, and they being Department of Finance, and they're typically off by 50 to 100%. So here, when it was $153 million, they thought it was going to be close to $300 million, and they thought this one was going to be about $250 million. So you can see that when you're trying to estimate. The reason you see the decline in the annual adjustment really has to do more with the timing and why we saw this huge increase of cash transfers in 12-13. It just means that the annual adjustment isn't going to be as large because of Prop 30, which put more, made people pay higher taxes, which put more cash transfers into the fund, as well as treatment of capital gains. So that's why it's projected to go down. But then you'll see it goes right back up if that holds true. But actually the cash transfers you can kind of project given what the projections are for the economy. And so then we get down to what do we think your guys' funding is going to be, you know, based on those revenues. And you can see, you know, we're looking at a huge increase in the current year. And then if we anticipate the decline next year, because that annual adjustment is projected to go down. But then a huge increase in 16-17 as the annual adjustment goes back up significantly higher. The one thing, you know, as we talked a little bit today, and we talked a little bit in financial services about the state's proposing to look at modifying the distribution percentages among counties, factoring in revised estimates of the uninsured, given implementation of the ACA. And so we'll see what happens there. You know, I think this will happen. I think we will see a decline in 15-16. So if the state is true to what they're saying, and that we're only going to apply any changes to growth amounts, then you should have the same percentage in 15-16 as you have in 14-15. But then where potentially there might be a change would be out here in 16-17. But we have to wait and see. And hopefully, again, what we're talking about is only the increase above the amount that you're probably going to get this year. Would there be a modified or an updated formula? And again, part of where the state's coming from is the Bureau of State Audit lambasted them for not having an up-to-date formula when Bureau of State Audit did their review a couple years ago. So they're just trying to a little bit respond to that. And but what we try to emphasize is that you're funding programs with a volatile revenue source. And so if you start modifying formulas, then counties have to potentially cut programs if they're in a lose situation. So hopefully it would be that any sort of modifications to the formulas would just be above kind of this higher amount, and so, but everybody would still get some growth, hopefully. But obviously more to come on that. And obviously the revenues are just going like gangbusters. So in terms of budget, I think we're going to hit that 34% increase. Given where we are, again, the revenues, this 479, so roughly, almost 30-something% has already been deposited. That's a known amount. So the only thing that may or may not come in is this 1.2 billion here. And like I said, it's trending higher than even that 1.2. So I think it's a pretty good chance that we will see that much of an increase in the current fiscal year. The percentages, those didn't change, so you can keep those percentages for the current year. They're also, hopefully you're all aware of, and it might not impact the small counties as much, but the state is releasing funds that were dedicated to the MHSA housing program. So CalHFA, I don't know, is this ringing a bell to folks? Okay. There's an info notice. Go look at it, see if you have an amount on that schedule. If you do, request it and get those funds released to you. You can then use them on housing and housing-related activities, which includes, I think rental subsidies and stuff like that. Technically, what's interesting is those funds, when the state moved it from DMH to CalHFA, they considered them spent. So technically, they should have no reversion period, but we'll see if that applies. And then the other thing, some of you probably have the triage grants as well. So budget year, looking at next year, I think you're looking at probably a 10% decrease over the budget amount for the current year. And again, it has to do with that annual adjustment. Hopefully the state doesn't, in a down year, doesn't try to tweak the percentages. But given that that's unknown, if you want to be more conservative, then go lower than that. But hopefully, I think it's a pretty decent projection at this point. The other thing, again, we'll know whether that $249 million that's right here, we'll know that hopefully in a month and a half. And so it's a little bit less of a percentage of the overall projected revenues in 15-16. But if it should come in at $500 million again, then we might not be looking at a decrease. But anyway, at this point, that's the best I can say.
Mike,
yeah.
Question. How do we find our MHSA county percentage?
So 2 ways. One, again, State Controller's Office website has the allocations. You can go in and calculate it. There also is a DHCS information notice that specifies the percentage. And we can email out that too. But it's, I mean, those two, the SCO's website under the apportionment, local apportionment part, and DHCS under information notices, you guys should all, and MedCCC is the other one, you guys should all become familiar with it, because that's the best place to go for information.
To be conservative, would it make sense to use this year's ratio at the lower dollar amount for next year? Cross your fingers that they will only be affecting above current receipts.
So if if you want to be real conservative, I'd probably discount it. I'd discount it like 15%. And keep your same percentage, but lower the whole thing by 15% at this point. Depending on how conservative, some folks say, Mike, you don't know what you're doing, and we're going to discount the heck out of your stuff. And then you can see revenues are probably going to come in higher than what I was saying, 6 months ago.
I've watched you now for 3 years, and you've consistently under projected NHSA, so I'm willing to use your numbers.
Well, some people would say that's well, it is and it isn't, because you're potentially not expanding programs and doing things. But given the volatility, unless you've got a huge prudent reserve, I think you have to be conservative on this stuff. And I didn't have anything in here on prudent reserve, but I think the state was pretty close to accurate when they were going to require the 50% of your expenditure level, because that, I've done a couple of analyses, and that would carry you through a downturn. So if you had a 50% prudent reserve level in your CSS, you would still be able to carry yourself through a downturn like we saw a couple of years ago when the planning estimates declined. So it's a good target to have, but not of your revenue, but of your expenditure level in terms of the prudent reserve. All right. Yeah, Tom.
When you say expenditure level, are you also including what you might be pulling in from Medi-Cal?
So theoretically, I would say your net, but it's not going to hurt to have the gross, because eventually some of that Medi-Cal that maybe are the 100%ers right now is going to go down to 90%. That may ebb and flow. So, but I mean, you're going to end up, I mean, this is a pretty big year for MHSA, so you're probably going to end up with some monies, and I didn't have this in here, but hopefully you're all aware you got to track it by component, CSS, and actually the way the statute reads is 20% goes to prevention and early intervention programs, balance goes to community services and support, i.e. systems of care, and then of that total, 5% must go to innovative programs. So you can do that a couple of different ways. One is you for sure have to take 5% of your total allocation and put it towards innovative programs. How you then split out the remaining 95%, I think is somewhat of a local decision. You need to, you could say that we're funding this entire 5% of innovation out of PEI, in which case you're going to go 5% innovation, 15% PEI, 80% CSS. You do vice versa, 5% innovation, 20% PEI, and 75% CSS, or you can do something in between. And what the state had done was they took 5% proportionally out of CSS and out of PEI to where they went 5% innovation, 19% PEI, and 76% CSS. But I do think you do have somewhat of a local decision at this point, depending on what your needs are. If you were late getting PEI programs up and going, and so you're starting to accumulate huge balances, you may want to fund the entire innovation stuff out of PEI. The other thing is you have 3 years to spend the funds. So any funds that you receive in a given fiscal year, that's basically year one, and then you have 2 more years to spend those. So hopefully you're tracking that, again, at a component level. So from a management perspective, you've got the 3-year reversion that you can use to manage the funds, as well as you can put CSS for sure into the prudent reserve. There are limits that you can put on it, or the Act limits it to no more than 20% of your recent 5-year average allocations. So if you get to the point where you're looking at CSS funds potentially reverting, you definitely want to stock those into the prudent reserve. You need to do it through an update to your plan, go through your stakeholders, post it for 30 days, and then do it to avoid reversion. So you've got really those 2 tools, the 3 years to spend and the prudent reserve to kind of manage your MHSA funding. So in a year like this year, where you have a ton of money, you're going to want to look at how is that impacting Do I have a bunch of prior year balances I'm carrying forward? Do I need to look at potentially putting some of this into the prudent reserve?
Is there a limit on how much you can put into your prudent?
There's no maximum. It's just in 1 year, you can only put, and it's not just the prudent reserve, it's move money from CSS to either the prudent reserve, workforce education and training, or capital facilities technological needs. It can be no more than 20% of your recent 5-year allocation. So if you add up all the money that they distributed to you over the last 5 years, what's the annual average? Take 20% of that. That's how much you can move to those 3 things in a given year. And so theoretically, if you did that every year, eventually you're going to have a lot of money. But again, you got to go through the stakeholder process. So you, as that starts to build, you're going to get flack from your stakeholders, especially if there's a need or a perceived need in the community for mental health services.
Right.
So, but definitely use it as, I look at the 3-year thing as, in terms of the 3-year ability to spend the funds as my first line of defense. And then if I'm going to bump up with a potential reversion, stock it in the prudent reserve to avoid reversion.
Could we go back for just a second to that, the last payment that we received for last year that, I call it the true-up, but it was that big payment that we got that kind of had the cleanup from the tax revenues from the prior year. It was quite a bit of money for us. So I'm trying to figure out how we could project that or how I could explain to a new director why I'm going to decrease, and yet last year we didn't budget for it and then we got this extra money, and I'm thinking she's going to think that's crazy.
Yeah, I mean, well, the only thing you can do is really show them the revenue chart and say, this is what the state's projecting. You can see how volatile, it's gone from negative 64 million. They're projecting 513 million out in 16-17. It's been as high historically. I forget what fiscal year. It was 580 million. So, it's, I don't know how else to say it other than just truing up. And then I would also point out that, okay, in the January budget, again, you could show 14-15 or 13-14. The state anticipated, 300 million, 13-14, and when they actually figured it out 2 months later, it was half of that. This year, they thought it was going to be 200 and something million. It ends up almost, twice as much. So, it's really a guesstimate in terms of what it's going to come in at. I do think there's some logic in it declining in 15-16 because what happened, it was 12-13, which is why we saw this huge bump. You can see cash transfers went from 900 million to 1.2 billion. Part of that was due to the passage of Prop 30, which increased the tax on folks, on high-income earners, which meant that they had to pay more personal income tax payments. Not that the fund earned more, but that there was more cash going to the state because of this, which increased our cash transfers. But that's going to mean when they do the annual settling up, it's not going to be as high. The other thing that happened was the expiration of some of the preferential treatment on capital gains at the federal level. So people recognized their capital gains prior to that taking effect. So they had more income in that year. Doesn't mean the fund earned more, it just meant we got more cash. And so that's why the annual adjustments projected to go down. We could find out that, no, it didn't, that actually everybody did really, really well, and we got more cash here, plus we're getting $500 million. I mean, and we'll know that in like a month and a half. So in fact, probably, what's that? That's like the April call. I'll try to make sure and bring back to you guys whatever that result was, so that if you need to modify any sort of your budgets for 15-16 based on that. Again, hopefully you're not super dependent on every last dollar of the MHSA because of how volatile it is. But in some instances you are, and for whatever circumstances. So,
Mike,
right. Yeah.
I think it was determined a while ago that PEI funds could be put into prudent reserve. Is that true?
So, We believe so.
Okay.
So the statute, there's 3 separate sections of the statute that talk about prudent reserve. One is very specific that says you're required as part of your plan, your MHSA annual plan, to have a prudent reserve for PEI. The problem was the state then says, well, there's this other section of the statute that limits the amount to go into the prudent reserve of 20% of your recent allocation. It can only come from CSS. And, you know, Tom, you probably know more than I do because I haven't been involved with any of the executive discussions. But I thought the state said they're willing to fix the statute because they don't really have a preconceived notion one way or the other. So hopefully that occurs. But
well, I think they've talked to their attorneys and got sort of a different opinion that you can't use PEI, and then we're providing other county attorneys' opinion summaries to them to have them go back and re-look at it. So it's still back and forth.
Yeah. I think it's in the state's best interest, especially the Oversight and Accountability Commission, which has more teeth in PEI than they do in CSS, to not have these funds, to allow the funds to go into the prudent reserve and not have them basically revert is kind of the opposite. So, but if you've done it, I mean, you're still at risk for this potential issue being resolved negatively. That said, there's no reason it can't go beyond just county council talking to DHCS attorneys to a higher level. There's no reason you couldn't bring up the whole thing. Well, you guys took $860 million of ours, probably illegally, and let's throw that into the mix and see where it gets. Because that's what the child advocate.
The other part of that question, then, I guess, is that if it does go into prudent reserve, does that, in effect, for lack of a better word, launder the money so that it can become out? So
this is, again, so the state said, yeah, there's just one prudent reserve. I don't agree with their logic, but they said once it goes into prudent reserve, because it doesn't meet the intent that 20% go to PEI, 80% go to, or the balance go to CSS. Because now you put in some of that 80%, and you put in some of the 20%, you're pulling it out as part of the 80%, and it isn't staying true to the act from that perspective. And some of the stakeholders are pretty adamant that it went in as PEI, needs to come out as PEI. But the state information notice, which, I mean, it's kind of like, I feel like we're picking and choosing which ones we want to listen to and not. The state information notice says once the statute says there's only one prudent reserve, and it doesn't specify how money comes out. So yeah, but it might be a little risky. But if you do it now before anything changes, I mean, but yeah, I don't know. I mean, yeah.
Other question. Where will you look on SCO to see that actual annual adjustment number that you will report on that April call? Also,
so you don't. So SCO. This is an actual letter that you wouldn't find it on SCO's website. So CBHDA will get a copy of that letter, and we'll let you guys know. There's nothing to look at other than trying to think. So there's 2 things. The state is required to produce a MHSA legislative report that's supposed to provide that information, and they're supposed to do it in January and in May. They tend to lag by about 6 months, so that's kind of not that great. But the OAC does put out their financial report pretty timely, but again, they do that in January and May. So there's really the other place. Actually, CBHDA has started posting that letter when they receive it, both in the Financial Services Committee website and on the MHSA committee. But it's a letter that you need to see. You won't see an actual anything on the SCO's website for it.
There's a second part to the question. Is there a monthly report tracking PIT receipts? Where do you look?
So there's so since this year is the same as last year, you can actually track your distributions and see eliminate that August distribution, which was obviously a lot higher. But beginning in September through the rest of this, you can kind of see where you are year to date versus where you were last year, excluding the August, and see if you're higher or lower. And that gives you an indication on the personal income tax payments. You can also look at the Department of Finance, puts out what's called the monthly finance bulletin. They don't do it every month, it's a problem, and they say whether the amount received in the MHSA fund was greater or less than what was anticipated. And that's on Department of Finance. I think it's under monthly bulletin, something like that.
And you can drill into the detail and get the CIP number and it's
yeah. But really right now, I think we're in a situation where you actually can kind of look, well, last year in February I received X dollars, this year I received Y dollars, and so is that more or less? That will tell you how it is tracking this year. But you can't look at the August thing because that's the annual adjustment.
Do you ever, are you able to reconcile that August amount to anything?
No. Well, but I will say, so, and there is a schedule that comes out that the director of CBHTA does receive that shows how it reconciles out. And I mean, sometimes I get it, sometimes I don't, but so they're accounting, yeah, and it goes to more, yes. Now whether, I think it also goes to the OAC, I believe it even goes to the legislature, but there is, and it's done monthly. I mean, so they are, I'm more concerned about like the 1991 realignment and the 2011 realignment than I am MHSA.
So the beauty with MHSA is when we're in a rising economy right now, we get it all. We don't have to wait for growth.
Right.
In the current.
Right. But you're actually waiting 2 years with the lag and the settling up, but you're at least getting the growth that people are earning more and they're paying more personal income taxes. So yeah.
Can you briefly discuss SAMHSA grants, MHDG grants, and how that works and how much money is available?
No. I mean, I don't know statewide. Yeah.
The answer is no.
Right.
Good answer.
And we're getting close on time, too, because I did want to cover a little bit of Medi-Cal. So hopefully, you know, your Medi-Cal, especially mental health, because there's also some questions I know that are probably going to take longer than 3 o'clock. I thought we were going to be done early. You guys fooled me. So you guys are reimbursed a percentage of your actual expenditures based on your certified public expenditures. And then there's what's called the FMAP that's applied against those CPEs, and that depends on the aid code of the individual. So the traditional Medi-Cal program, everybody's 50% reimbursed, but now you've got some newly eligibles that you're getting reimbursed at 100% federal reimbursement, assuming the state adjudicates the correct aid code, that those will eventually go down to 90%. I want to point out, too, that this is the same for all Medi-Cal special mental health services. So you're incurring the CPE, you're certifying it on a monthly or however, whatever frequency you're submitting claims. The one exception to that is the fee-for-service Medi-Cal inpatient hospital services that I talked about earlier that are the offset to your 1991 realignment or your managed care offset. For those, the hospital commits a TAR to you. The hospital actually receives payment from the state, and then the state reduces your 1991 realignment by the amount of match required for that service. So that's the one exception for Medi-Cal, especially mental health services. It's the same whether it's a kid or an adult. So there's no difference for EPSTT than there is for the adult Medi-Cal. You've got to incur a certified public expenditure. But to try to approximate what your CPE is, the state has these interim rates, and and your approved units of service or minutes of service. And for a contract provider, that should be the amount that you're paying the contract provider, should be your interim rate. For county-operated providers, you want to approximate actual costs. The state has set some maximum levels in the system, so you can't exceed your most recently settled cost report adjusted for inflation. But really, what you want to claim at should be what you think, given what you know, your actual costs will be. But that's the way that you guys get reimbursed on an interim basis. We then have this reconciliation process, which is done through your lovely mental health cost report. And that, so you submit your initial cost report generally by December. This year, who knows when it will be, as soon as they fix the templates. And then really nothing happens with that interim cost report until they are ready to do the reconciliation process, which is generally another about 18 months following the close of the fiscal year when they're on time, to allow you to account for all your services, get them into the system, get them approved. And it's really that reconciliation process. It either generates a settlement payment to you or generates a recoupment from you for the FFP. One thing we found out today, which is actually a new process, that they're going to wait until they have the settlement complete. So basically, you probably received your settlement letter, and if you're owed money, that you won't get that money until the next budget cycle at the state level. So they want to wait till they have the final amount. That will feed into the budget cycle. So it probably delays it at least a year in terms of an actual settlement payment. So we'll see how that goes. But they'll probably recoup, within 60 days or whatever. So, and then obviously DHCS audits these cost reports to determine your final Medi-Cal entitlement. So that's the process. And that was, there's supposed to be another slide in here that I missed. So I had pulled some stuff from the budget that isn't in here that shows the amount of FFP, basically the kind of the existing program, the amount associated with the supplemental payment program, and then the amount associated with the additional FFP. And that is what, so this slide here actually shows you everything, then your entire anticipated funding. But to keep on the FFP, the amount that is coming in at the 100% level is significantly more than they initially estimated. So hopefully you guys are seeing that as well. I think in 13-14 it was about $100 million. I think they're estimating it to be somewhere around $300 million in 14-15, and then up over $400 million in 15-16. So obviously a very positive effect of the Affordable Care Act on your guys' reimbursement. The supplemental payment, and I know Chuck didn't know the details, but I did look at their budget, and it all is in 15-16. So what the supplemental payment is, there's a state plan amendment that's been pending since 2008-9, since January 2009, that will allow you to get reimbursed in excess of the SMAs if you have certified public expenditures that exceed the SMAs that were in place up through 11-12. They're still working on that state plan amendment. Hopefully it will be approved by CMS this year. But the entire amount, and I want to say it's about $400 million, is all out in 15-16. So for those of you, does anybody here through 11-12 have actual costs that exceeded the SMAs on the cost report? Okay. Just one. So
through 11-12, or you mean like
up to 11-12. So
you have a lot of money out there.
Basically from January 2009 through 11-12. I think from a budgeting perspective, I would not include it in current year, but I think there is hope that they're going to allow you to have that in budget year, and you'll have the process in place to get that money.
If I can go back to the increased FFP,
Yeah.
we have no way of finding out how much that's going to be or how many of these people that we're serving. And so how can you budget that?
Yeah, no, I agree. So, hopefully you are seeing an influx of FFP or it's higher. I mean,
higher amount, but we don't know who. I mean, you'd have to go into each and every person to see what their U code is to see if you're getting reimbursed at 100% versus
right.
the only.
And even if you're getting reimbursed at the 100%, as we know or we've heard, that's not necessarily. There might be more that should be reimbursed at the 100%. So
it's hard to budget. When we start stepping down to the 90%, how much is that going to impact?
Yeah, I mean, if you can't, if your claims processing data can't produce the reports to tell you, which of those codes are at the 90%, then or at the 100%, then it's going to be difficult because I don't think the state.
The state would be the only one with that data because they know
what. But it comes back on the 835. So you need the ability to look at the 835 to figure out what aid code it was adjudicated at. Yeah.
Rich, all the 837s of all the aid codes, the 835 that came back with the one that was approved, to know which one's what. It's like a system for the.
Well, again, hopefully, a lot of you guys are on one of the two systems. Hopefully, they're working on canned reports that should be able to. I mean, your claims processing system should be able to spit it out for you. You would think. So.
We know what we're getting billed out, but we don't know what's
coming back. Yeah.
We don't have all the details to match it. So just if anybody has any suggestions, how we can build our budget for this in the future would be helpful.
Yeah.
Because I'm being asked by my director,
right.
How much has this helped us? I can't tell us.
And I'm getting asked the same question, and all I could say was, well, it looks like we have 60 clients since January that were never in our system before, but
you don't know if they were 100% or they're 50%.
I mean, it's a lot of your existing clients that are hopefully now that you're getting eligible. So, yeah. I mean, it really comes down to being able to get reports from your systems. Which is why we need to get out of doing claims processing associated with reimbursement. But anyway, so we have like 5 minutes left. And I did. So one thing in general, in terms of Medi-Cal, and because I know you get a lot of pressure from providers, and what should you do? Should you increase, decrease, whatever? I do think so. Hopefully, everybody, because I don't have time to go into the modernization project, and we're looking at capitation at some point down the line, or case rates, or whatever. But some sort of prospective payment system that more than likely will be based on your actual experience. So this isn't the time to be reducing or, playing hard line with services. I think in terms of Medi-Cal, I think the more, that the services meet the medical necessity criteria and they're within, their SMI services, then you want to be providing them and funding them, again, given the limit of your revenues that are derived from sales tax and tax on millionaires. But it's definitely not a time to be cutting back, because you could set yourself up for a historical basis that has a really low capitation rate or case rates that may take some time to build up. So you definitely do not want to be cutting services at this point. That said, you don't want to be going gangbusters. I think you want to, what I always say is you want to do what's right. You want to do what's appropriate, provide the appropriate treatment for the clients that are appropriately community mental health. So, I mean, I know that's kind of an ideal world, but that's just kind of an overarching message. So I would not try to be cutting anything associated with Medi-Cal at this point in time. One other thing came up about Beacon and the mild to moderate, and those of you who may be entering into contracts to serve the population really that is the responsibility of the health plans, and how does that trickle into this. And because the health plans are paying for those Medi-Cal clients, by definition, they aren't Medi-Cal specialty mental health. They're the health plan's responsibility. And so really they shouldn't be in anything. They shouldn't be in your cost report. You shouldn't be entering them into your claims processing system because, again, you're getting a Medi-Cal payment from another entity, the health plan, whether it's through directly or through Beacon. So you definitely want to keep those out of your costs. Don't treat them like other or non-Medi-Cal for purposes of Medi-Cal, especially mental health, because again, then theoretically at the state they're being double counted because Beacon or the health plan should be reporting encounter data to the state on that beneficiary and on the services you're providing to that beneficiary. And if you're also counting it in the short-term Medi-Cal side, it would be double counting. So hopefully at some point the state comes out with guidance, but I think at this point that's kind of the best advice we can give. What else? And then there was a question that if you opt into the drug Medi-Cal waiver, that you're going to lose this $100,000 minimum. I'd be, well, I don't know why the state would do that, number one. I mean, it seems like the $100,000 minimum was to entice counties to provide the more robust drug Medi-Cal benefit that the state should have been doing for a long time. So if that's true, I'd be, it's a disappointment, but I don't know why they would want to do that. The only thing I could think of is, are they going to give you state general fund instead of the $100,000 drug Medi-Cal, which makes no sense at all, because that was the whole purpose of realignment, was to reduce the amount of their state general fund obligation. So anyway, then I don't know. So we've got this partnership thing with the IGTs. Anybody doing that?
Yes.
Okay. And is it a good thing?
I'm thinking it's a good thing. It's my first time through it, so lots of stuff going on. But I'm looking at $3.5 million, so that's a big chunk.
So what this is, for those of you who aren't aware, I guess partnership is coming to counties saying.
Well, for partnership counties, I mean,
yeah.
so it depends whether you're a partnership health plan county or a Centene Blue Cross county or whomever, but partnership, if you're a partnership health county for your managed care plan, then they're doing a whole lot of work to lead the IGT process for their member counties.
And IGT is intergovernmental transfer, so they're asking mental health plans for services to the mild, correct me if I'm wrong, mild to moderate that are Medi-Cal that you're doing to transfer basically the cost of providing services to those clients, and they'll be able to include those in their 1115 waiver claim and give you back twice as much or something like that.
I mean, basically, again, it's just another way of drawing down FFT.
Right.
So if you spend dollars on mild to moderate, basically you can kind of ante up the match and draw down the federal funds for those.
So it'll be interesting to see, because I'm not sure, I don't know enough about it. I talked to Noel a little bit earlier, whether you would include those costs as part of your cost report or not.
You absolutely have to keep them out of
your cost report, even
as
a non-Medi-Cal
cost. You have to keep them out of
cost.
this short oil system.
Altogether.
They need to be outside of that carve out.
Okay. So there you go.
One of the big things. Yeah.
Okay.
Mike, a good example of how a county might benefit from that would be if you're taking, let's take some of your MHSA dollars and you're contracting with schools who then are having employees that are licensed out in the school sites. And it doesn't have to be licensed MFT. It could be even a credentialed pupil personnel services person. They're providing group counseling, but it's educational counseling. It's not treatment counseling. Those dollars then really, some of those students are Medi-Cal beneficiaries, and they're certainly not SMI. So if you can figure out the approximate number of Medi-Cal beneficiaries you're serving, those would all be eligible IGT services for which the county can then get reimbursed through the IGT process. And so essentially you're kind of doubling your MHSA dollars.
Yeah, whether it be MHSA or 91 realignment or anything. But yeah, I mean, you know, I think, well, a couple things. You know, definitely make sure you keep good records, obviously, and then just make sure you're not somehow billing it on the short-term Medi-Cal side, just like you wouldn't if you. I mean, it's no different than the Beacon thing we were talking about earlier, and just keep it separate and keep it out because it's not a Medi-Cal, especially mental health service. So, but it sounds potentially promising. It may be somewhat short-lived, but we'll see.
Hard to
you know,
gauge.
yeah. Dealing with the 1115s, you got a lot of flexibility in those waivers. Sometimes the payments are lag. You know, DHCS, I'm sure, will take a little cut somewhere where they're getting covered some of their costs. But if you can, you know, get more money than you would have otherwise, it's a good thing. So, and I think one last one. So when you're looking at the cost report for Medi-Cal, especially mental health, versus MHSA, how to deal with the Medi-Cal associated with reporting it on the MHSA cost report, or the MHSA revenue and expenditure report. And I think the key, your Medi-Cal, especially mental health cost report should always be accurate. I mean, that's, you know, that's way more important than the revenue and expenditure report. Fortunately, I believe in 1213, they changed the format on the revenue and expenditure report to allow for adjustments based on settlements and so forth. So if, for example, you had thought you were going to use FFP to fund part of a Medi-Cal or an MHSA program in a prior year, auditors come in and disallow all those Medi-Cal, they ended up using more MHSA, I think you can now report that as part of the revenue and expenditure report. But really the key is make sure your Medi-Cal cost report is accurate. And the other kind of a related issue is whether you even want to show FFP as funding the MHSA programs. There is a spot on there now where you report total FFP generated by those programs. Whether you want to use that to fund the program is up to you, because the state has not come out with a policy on that yet.
Well, I mean, at the end, you chose not to. I mean, I think that was guard against some reversion risk, right? Yes. Because you're spending the MHSA first, and then the FFP is sitting there to draw on indefinitely.
Yes. Which is, again, you know, we want to see some regs that specify some of the policies, because the Act doesn't say gross or net MHSA.
Right.
And if it said gross, then it doesn't, you know, but you could still use the funds if they're going to give you credit. So, are there any other questions? I get all yours through the revenue. Okay. Any other questions? I know we're a little long, but hopefully give you a little more information to take back and put together your budget. And we'll get a couple of links and emails, or we'll get one email with a couple of things in it out to folks on the FCO website. Yeah, so the FCO website, DOF. Is everybody aware of their realignment MOE? Everybody know what it is? Or you guys want to put that in?
Which realignment is that?
The 1991. The 1991, your share of the 48 minutes. Yeah.
Put that in.
That would be good.
I think those are 3.
Did everyone fill out your evaluation forms, the yellow things? And does anyone know where the sign-in sheet is?